Hello. So for today's health check, we are going to pay a trip to the hospital. We're actually at Hospital Picaso.
Yes, and we are going to be having a conversation with two doctors about navigating breast cancer prevention. So I'd like to introduce our two guests today, Dr. Harjit Kaur, consultant oncoplastic breast and endocrine surgeon, and Dr. Christina Lai, consultant clinical oncologist. Hi, ladies.
Hi, good morning.
Hellos.
Good morning. Okay, so we're going to dive straight into it, right? And talk a little bit about breast cancer and early detection. So obviously, Dr. Harjit, will start with you. So by the time you see your patients, a lot of them are at various stages of breast cancer. So how does early detection actually impact the type of treatment that the patient may need?
Well, actually, as a breast surgeon, I tend to get first view of a patient in their journey when they are diagnosed with the breast cancer. And early detection actually has a profound impact on their journey. In the sense that it not only affects their medical outcome, but also their emotional, physical, and psychological outcome. And when a patient is diagnosed early, their options for treatment is tremendous. So they get to be offered breast conservation surgeries where they don't need to lose their breast or have a mastectomy. They are suitable candidates for something called a sentinel node biopsy, which is the gold standard management for lymph nodes in the armpit.
Right.
As opposed to traditionally where, they do a clearance where all the lymph nodes or majority of the lymph nodes have to be removed. And sometimes the lymph nodes are completely healthy, and so it's an unnecessary surgery.
Right.
Apart from that, I think depending on the biology of the cancer, they may escape chemotherapy completely.
Okay.
If it's early,
Yeah.
they may be just suitable for hormonal therapy, which is just tablets. And interestingly, now these days, we also have opportunities like intraoperative radiation therapy.
Wow, what's that?
For patients who are who fulfill certain criteria in early disease, they get to have their radiation during surgery. Meaning, during the operation, while they're under anesthesia, about 16 to 25 minutes of radiation on table is almost equivalent to 5 weeks of external beam radiation therapy.
We have that technology already.
Yes.
It's
And we've been
crazy.
practicing this for a few years now.
Wow.
And so it makes an amazing difference to the patient.
Yeah.
The side effects of the radiation is minimized as well. And the entire treatment is done in that one operation and they're home the next day.
And this is the difference, yeah, between detecting early and then coming in later on.
Exactly.
Right.
Exactly.
I always tell patients, the general public, be a bit kepo, go dig into your family history a bit. In our Asian culture, it's always hush-hush, right? But know your family history. Be aware, how to examine your breast and all that. Don't be shy. So empowering women, especially young women, to be more proactive in their health, yeah.
Now, there are a lot of fears when it comes to, obviously, cancer and breast cancer. And one of the huge fears is losing your breasts because, they see that as losing as part of themselves as a woman. So, Dr. Harjit, could you explain to us a little bit more on oncoplastic breast surgery? So, what exactly is it? What do you do? And how does this kind of help with that fear?
I mean, first of all, you're absolutely right. When people talk about cancer, the minute they're diagnosed with cancer, the first thing that runs to a woman's mind is, that's it, I'm going to lose my breast. And unfortunately, that's how we lose a lot of patients as well, because of their unfound fears, and they resort to other kinds of modalities. So oncoplastic surgery, in very simple terms, just mean the oncology aspect and the plastic aspect. So when we talk about the oncoplastic surgery, the oncology is removal of the cancer safely and surely. And the plastic part of it is the reconstruction that we offer to the patient, rather reshaping of the breast or reconstruction, depending on the suitability. So we are doing everything together, not just so much for a cosmetic purpose, but it is a planned surgery where the intention is to give the patient the best possible outcome in terms of contour, normalcy, so that she sort of feels that she still retains her natural breast shape and size and things like that. But the important thing to understand is that it is not a boob job. as people
Yes,
talk
it's
about.
not purely aesthetics.
Exactly. It's not purely aesthetic. It has a functional reason that we do these things as well. So it has a tremendous impact on these women in terms of their physical outcome, their emotional, psychological outcome. And we see their quality of life actually is much, much better after
It helps with
reconstruction.
healing because
exactly.
you see, they don't feel like they've
Exactly.
lost a part of them,
Yes,
right?
yes.
Think of the good point of screening. You pick up, like what Dr. Harjit said, if you pick up a cancer that's early enough, the treatment is very straightforward and easier.
Yeah.
So to elaborate more on that, right, the importance of early detection, right? So Dr. Harjit, could you tell us maybe what are some of the early warning signs that somebody may have breast cancer and that should not be ignored? Like what to look out for?
I think the first thing that I would like to highlight to everyone out there is cancers are generally painless. So don't wait for pain and then come running to a hospital because often it's a little too late. So a lot of people have this idea that, they feel that lump in the breast, but because it doesn't cause them any pain, they think it's all right to just leave it alone.
Right.
So this is one of the first misconceptions that I would like people to, get out of their mind, that anything abnormal in your breast needs to be addressed. So some of the early warning signs that you would look for is actually even a subtle change in the size of your breast. So important is you need to know your breast first.
Absolutely. That's why it's important to continuously
Exactly.
have a
So
self-examination.
self-breast checks are so important for that reason. It's not about looking for lumps in your breast, but it's about just looking at yourself and recognizing what's normal for you. Because unless you know what's normal, you'll never pick up anything abnormal. So if you look at yourself regularly and you suddenly notice one breast slightly larger than the other or slightly smaller, that's a warning sign that there's something brewing inside. The other thing is your nipples. Some people are born with inverted nipples, but if you are not, and all of a sudden you see your nipple getting retracted in, that is a really dangerous warning sign that there is a possible cancer inside you that is pulling onto your nipple and, contracting it and, retracting it inside. The other things are subtle changes on your skin. If you just notice the skin is feeling a little thickened, you get this peculiar feel that's not right, and your gut feeling knows that this is something not right, you need to get yourself checked. Nipple discharge is another dangerous warning sign. I mean, some discharge are normal. Any woman who's had a baby, who's breastfed, will have some little bit of discharge, but that's if you squeeze the nipples. But if you have spontaneous nipple discharge, just coming out on its own for no reason, that is definitely not normal and it must be checked. So these are some of the subtle signs that people must, pay attention to your breast. It doesn't just mean a big breast lump. So you need to even look at your underarms because sometimes the cancers can present with lymph nodes under the armpit. Not so much the lump in the breast. You may not pick that up because it's small, but it can manifest with the lymph nodes first. So the lumps in the armpit is also a warning sign that, it's not normal to just have large lymph nodes in your armpit. You need to go and get it checked.
Okay. Yeah, they always say, right, prevention is better than cure.
Exactly. And I think listen to your gut feeling. If your body is telling you something's not right, don't sit and procrastinate. Just go get it checked.
Yeah, it really is one of those things that's not going to go away on its own,
exactly.
Right?
Exactly.
Dr. Christina, okay, so, we're speaking on like a prevention standpoint. What are some of the lifestyle changes that people need to start practicing in order to help prevent, or increase the chance of not getting breast cancer?
Yeah, so when we talk about lifestyle, that is one of the modifiable risk factors. So we talk about breast cancer risk. We generally, doctors divide it into the non-modifiable ones, like your age, your family history, when you had your menopause and all that, so that you can't change that. But the modifiable risk factors are the critical ones that you can make a difference. So being overweight is the top one. You don't have to be obese. A lot of us are overweight without realizing it. So do work out your body mass index and try to see if you're overweight. So overweight, the top one. Second thing that is related to that overweight is exercise, regular exercise, and also a healthy diet. So as usual, I think everybody knows this. More vegetables, fruits, high in antioxidants, and that protect our cells. Of course, we know things like reducing your alcohol intake, all that smoking, that's all bad for you, yeah? So those are general things that most people know in their head, but they don't practice it. Okay, so everyone needs to pay attention to their health. Yeah.
Wow, so much easier said than done for a lot of cases. But let's just say we've convinced this person. Somebody watching this is convinced, and they're saying, okay, yes, I need to go get myself a breast screening. I need to do something today. We've addressed all of the fears. Now, Dr. Harjit, could you tell maybe somebody watching this who probably has never done a screening before, what is the first practical step that they can actually take today if they come into Hospital Picaso?
I think the first thing they can do is schedule an appointment. They can come and see one of the doctors. It's important to do that because when you have a consult with a doctor, you can actually have your, your risks gauged.
Okay.
So through a consultation, when we go through your history, your background, your family history, then we sort of put you and sort of curate a right screening program for you, depending on your age and your risk factors. So whether you require a mammogram or an ultrasound or both, in some situations, those who have got high risk family histories, we'd like to also put them sometimes on a MRI screening because they are considered high risk.
Right.
So I think it's important to do that. So you just schedule an appointment and let us sit down and see what the ideal sort of screening that's suitable for you and get on with it because you just never know what's going on in your body unless you do a check. And the whole idea is to catch a disease early because early detection is definitely going to give you a cure.
Yes. Dr. Christina, so how important is the personalized treatment for breast cancer, and how does Hospital Picasso actually approach this?
Okay, so maybe let me just clarify what does personalized medicine means.
Yeah.
So it's the concept that, not every breast cancer patient is the same. Just like how, my patients sit in the waiting room and they're comparing notes with each other. It's like, why did you get that? I didn't get that. And then they'll come in and ask me, Doc, why did that person get that? And I didn't. So I think just, understanding that the biology, I think we've mentioned this. So for the layperson out there, the characteristic of your cancer. So even if someone's got the same type of cancer, the genes, the DNA changes that cause the cancer may be different. In the two similar type of breast cancer. So knowing that helps us doctors to really formulate a plan of treatment according to that biology, right? So for us in Picasso here, we are trying to create a one-stop breast cancer center for our patients. So here we involve a team of doctors. So there's Dr. Harjit, a breast surgeon, or an oncologist like myself, as well as two other doctors that maybe the patients don't see so often, the radiologist, so the specialist that reads your mammogram or your scans and interprets that, as well as a pathologist. So a pathologist is a doctor in the lab that reads or study the specimen from either your breast biopsy or the surgical specimen and give us a formal report. So these two people are also very critical to help both myself and Dr. Harjit make a plan for this patient. Now, not only do we also look at the medical side of the patient, we have to think about the social circumstances of the patient. So, for example, a very young patient who's just got married, planning to start a family, and now you're telling her she needs to have chemotherapy. How is that going to affect her? So these are all the factors that the team has to consider. So we work as a team in Picasso here.
There you go.
Wow.
It's good to know that you actually have like a whole team of experts batting on your team. Thank you so much, Dr. Harjit, Dr. Christina, for answering all of our questions. And I think if you were to sum it up, right, the key points that really stood out for me were
Go get checked.
absolutely get to know yourself, get to know your breast, get to know your family history and your risk factors. So don't be afraid when it comes to getting to know your body, your breast, and what options you have, because early detection can make a huge difference.
And bring a friend, bring your partner along with you. Husbands, I want to see more of you in the hospital supporting
Exactly.
your partner. Huh?
Yeah. And where to go? Come here.